Understanding the sections of the Mental Health Act is crucial for every mental health professional. These laws guide how we assess, treat, and protect individuals experiencing mental health challenges. Welcome to Growth with Joyce. We the future, confident in action. Knowing the legal framework ensures that we provide care that is both ethical and compliant with regulations, safeguarding the rights of our patients. Yes, please, have you subscribed? Please subscribe, like, and share the videos. This empowers us to make informed decisions that truly serve their best interests. Each section of the Act has a specific purpose, from voluntary admissions to involuntary admissions and treatment orders. Awareness of these distinctions helps us to navigate complex situations confidentially and ethically. Comment if this is something new to you. It also ensures we communicate clearly with patients and their next of kin, fostering trust and transparency during challenging periods. Please like the video and share. Furthermore, understanding this legal section is vital for safeguarding ourselves and other practice. It allows us to document correctly and act within our legal boundaries, reducing risk of liability or legal challenges. For example, we have different units, different settings. These sessions may vary. If you work in an acute, some of the sessions they use there will be different from a PQ ward. That's that they use often. Knowledge of law strengthens our professionalism and reinforces public confidence in mental health services. Mastering the sections of the Mental Health Act is fundamental for delivering safe, ethical, and lawful care. It enhances ability to support patients effectively while upholding their rights and dignity. Yes. For example, where I work, we have different types of units. We have the acute units. We have the PQ, which is in psychiatric intensive care units. We have the rehabilitation. We have communities as well. We have home treatment team. We have day team. We have the older adults. We have the children's services. Yes. In these services, like the acute, they have a lot of informal patients. That is, patient that has agreed to come into the setting voluntarily for treatment. And when they come, they have their rights read to them under that section. And you have other section of the Mental Health Act as well, like section 2, which is used for assessment. It's for us to assess you. Section 3, which is used for section 2, lasts for 28 days. And after that 28 days, or within that 28 days, when you come to the ward, you have the right to appeal against it. And also, if you're on section 2 and the doctors feels that you need treatment, the doctors will apply for what they call recommendation, so that they can put you on level 3 for treatment. The recommendation is done by one of the responsible clinician that looks after the patients, and the other one is a Section 12 doctor, an independent doctor, and an approved mental health professional like a social worker. So after the doctor makes his recommendation, the registered clinician of the patient, the other doctor and the social worker will come and assess the patient and see if the patient can be put on Section 3. If the patient is, after the assessment and they feel the patient needs Section 3, they will place the patient on Section 3. And after that, they will inform the patient that he has been placed on Section 3. Then, the rights of the patient, Section 132 rights, will be read and explained to the patient. When you explain it, if the patient understands, you document it. If the patient does not understand, you also document it. And you have to ensure, if the patient doesn't understand the section, you have to keep reattempting the Section 132 rights until the patient understands, and you document it. Under Section 2 of the Mental Health Act, every 2 weeks you have to read the patient's right and explain it to them. Section 3 lasts for 6 months, but it doesn't mean the patient has to be in the hospital for 6 months during that time, and it's for treatment. So you use it to treat the patient, because sometimes, when they are unwell, they might not want to be compliant. But under that section, we have to ensure that they receive treatment. You have Section 5.2, which is when a patient is voluntary and the doctors feels the patient needs to be in hospitals, the doctor and the patient wants to leave, the doctor can enforce that power for 72 hours so that the patient can receive treatment. You have the one for nurses, Section 4 is for 6 hours. As a mental health nurse, you have that right to section as well, but it's for a short period, 6 hours, so that the patient can receive treatment as well. So you have different sections. You have Section 48, 49, 48, 48, 41. So most of these sections, they are being used by the Minister of Justice, like patients who are coming from hospitals, from prison. So some of the words, it all depends on what is happening in that ward. Some of the wards, all the patients are sectioned. They are under the mental health section, like the PQ. So some of the wards are like that. So if you go to a particular ward, you might not have maybe a lot of Section 3 or a lot of 45, 48 or 37. So I'm going to make another video to discuss different types of sections. Different types. So I'm going to make a video of such. So thank you very much for listening to me today. We the future, confident in action. Thank you. Bye-bye.